As new positive COVID-19 cases are reported daily, it highlights that hundreds of cases had gone undetected for months. Minister of Health Dr. Frank Anthony, in an interview on Saturday, spoke to the issue while highlighting that his ministry has standardized treatment protocols in response to the pandemic.
An update from the Ministry of Health on Sunday indicated that confirmed cases were at 955. This means that 458 new cases have been reported since August 4, 2020. Minister of Health, the Honorable Dr. Frank Anthony, explained that he expects more new cases to be confirmed in days to come.
It is going to go up more because as we increase the amounts of tests that we are doing, we are going to see more positives, right? In the past, testing was very restricted. There was very strict criteria on when you will do the test, and therefore, if the test was only available after you get symptoms, you know, there's almost you'll have a clinical picture that this person is presenting with COVID, and then you do the test. So
added to this, he noted that previously less testing was done because there were limited test kits. The PPPC administration, upon assuming office, has managed to garner test kits from various donor agencies, countries, and organizations to support Guyana's push to identify and contain the spread of COVID-19. With this huge demand for more tests, the ministry is working assiduously to build testing capacity and have more test samples processed daily.
the testing that we are doing is using PCR, so that's a diagnostic test. We want to expand that capacity at the National Reference Lab, and we're looking at another site outside of the reference lab where we can have another facility. But at the National Reference Lab, as you rightly said, we have, with the use of the current machine, we are trying to get them to do more with the current machine. And that is why we have introduced the 3 shifts.
The minister also told DPI that the ministry is working on many fronts to mitigate the high number of positive cases being identified daily. He said as more testing is being done and new cases are being reported daily, preparations are being made to treat positive cases.
I don't want people to be alarmed, but we are going to see more positives as the day goes by. Now, we need to prepare. One of the things that we did last week was to standardize our treatment protocol for COVID-19 patients because we had a technical clinical working group, and these comprise of doctors from the Georgetown hospitals and other hospitals, and they were able to put together what would be our national treatment protocol for COVID-19. This week we'll be rolling out a training for doctors, and the Medical Council would be accrediting those doctors.
Beginning from the point of screening at all hospitals, the protocol guideline will ensure that persons visiting health facilities for treatment outside of COVID-19 are protected. For InfoHub, Delicia Haynes.